Hello, my name is Tilly Schumann, and I am a third-year medical student at Kansas City University. I'll be presenting a unique case of SMARCA4-Deficient carcinoma of the gastroesophageal junction. Rationale. This is an important case because this specific type of epithelial carcinoma is a very rare malignancy. This case report was studied in hopes to assist physicians in the future to understand this unusual cancer. Published literature. There are less than 20 documented cases with no guidelines for treatment. Within these cases, a handful of patients were treated with chemotherapy and still had poor outcomes. Any previous cases described were typically occurring in men who had a history of acid reflux and Barrett's esophagus. Case report. This particular patient was a 60-year-old female with a 50-pack-year smoking history who was experiencing dysphagia and epigastric pain. A CT scan revealed an epigastric mass suggestive of malignancy, along with multiple hepatic lesions and upper abdominal lymphadenopathies. A biopsy of the GE mass was conducted during percutaneous endoscopic gastrostomy tube placement for feeding. Here you can see a barium swallow study demonstrating narrowing at the JE junction and a CT image with the mass identified at the GE junction. Results. Overall, this adenocarcinoma variant is likely underreported due to limited awareness and availability of the SMARCA4 staining. The obtained specimen showed no histological evidence of Barrett's esophagus or metaplasia. Histological staining of the specimen was negative for many stains, some including pancytokeratin, CK7, CK20, S100, CD45, and cytokeratin cocktail, including SMARCA4, and many others. The location of the specimens and constellation of findings led the pathologist to believe this cancer is suggestive of SMARCA4 deficiency undifferentiated epithelial malignant carcinoma, a very poorly differentiated form of adenocarcinoma. Conclusion. What should be highlighted from this patient is how formidable the diagnosis of SMARCA4 deficient carcinoma is. This challenging diagnosis represents the need for increased awareness in medicine of rare diseases. There is a clear need for interdisciplinary collaboration to establish future treatment protocols to best care for our patients. This case report highlights the challenges associated with diagnosing and managing such a disease, especially in patients who do not fit the typical risk profile. Additionally, it underscores the importance of equitable access to healthcare resources to ensure that all individuals, regardless of their socioeconomic status, have the opportunity to receive appropriate care and support. Thank you for your time and attention.